You have just finished examining Mr. Jones, a 75-year-old man with advanced COPD. He is currently housebound and is on home oxygen. His CO2 is 75 and the pH is 7.34. His calculated lung age is 135 years. What should you do in terms of advanced care planning? Obtain permission. Never launch into an elective discussion about prognosis without asking for permission. It is rude. As you know, you have lung disease and it is fairly severe. I would like to talk with you about your prognosis, what could happen in the future in terms of your illness. Would that be all right with you?
Yes.
Given the seriousness of your lung disease, it is possible that you could have trouble breathing on your own. If that were to happen, you could require going on a breathing machine to help you. Have you ever thought about if you would want to go on a breathing machine?
I have never thought about it before.
Many people do not. The reason I ask is that I would not want to give you treatments you do not want.
I don't know. As I said, I have never thought about these things before.
There are two ways to support your breathing. One is to put a tight-fitting mask on your face and attach it to a machine to help push air into your lungs. Some people find that this makes them breathe more comfortably. Sometimes it is necessary to put a breathing tube into the lungs. During this time you would not be able to speak or swallow.
I would want the mask. I don't know about the breathing tube though.
It is important not to drive decision-making unnecessarily. I know this can be hard to think about, but have you ever thought that you could die of your lung disease? The answer is yes, or yes but not before now.
I become awfully anxious when I think about things like this.
Can you say what you are most anxious about? Is there anything in particular that you are afraid of?
It is very scary when I cannot catch my breath and I feel as if I am suffocating. I wonder if I am going to die and feel very panicky.
Always affirm that you have heard distressing experiences. It is required. That sounds like a very difficult experience. There are treatments beyond your puffers that can help your breathing feel better. Would you want to try other medications that could help you when you feel so very short of breath?
Yes, I would. Thank you, doctor. This sounds serious. How long do you think I have to live?
That is a hard question to answer. It is very hard for anyone to predict how long patients with COPD will live. This may sound like an odd question, but how long are you hoping for?
10 years or so.
I think that would be less likely. Are there things you need or want to do before you die?
Well, I am worried about how my wife will do. She says she cannot imagine living without me. I do the taxes and look after our finances, and after our son died 10 years ago, there is no one else to help her.
I am sorry to hear about the death of your son. If this comment sounds gratuitous, you probably don't have children. I wonder if it would be good for you and your wife to start preparing now for her to live on without you. I would be happy to meet with you both and talk further about your hopes and fears. Would that be good for you?
Yes.